If you've been told that you have PCOS, often you might be worried about how it might affect your ability to fall pregnant. I'm Brooke, a gynecology doctor, and I'm here to clear up some of the many misconceptions about PCOS and fertility. In this video, I will talk about what PCOS is, how you might know if you have it, whether or not it can be cured, and what it means for your fertility. So first up, what is PCOS? PCOS is a condition that can affect your periods, as well as certain hormones and aspects of your appearance. It can also affect your long-term health, and it is common, but that doesn't make it easy to manage. Polycystic ovaries are larger than normal ovaries, and they've got twice the number of follicles, which are the precursors of eggs. But not everyone with polycystic ovaries has polycystic ovarian syndrome. It's estimated that about 30% of all women and people with ovaries have polycystic ovaries, but PCOS as a syndrome itself is less common, maybe affecting around 15% of all women, depending on the criteria that you apply. Something so common, it is certainly not talked about nearly enough. Now, the cause of PCOS is not yet known, but we do know that it runs in families. So if you've got other relatives like mothers, aunts, sisters also affected with PCOS, your risk of developing PCOS may be increased. The symptoms you get are related to how your body manages certain hormones. So firstly, you will have raised androgens. These are a family of hormones that includes testosterone, and androgens are produced in small amounts by the ovaries in all women. Women and people with PCOS have slightly higher than normal levels of androgens, and this is associated with many of the symptoms of the condition. It's also one of the things that can lead to its impact on fertility. Another hormone change is insulin resistance. So insulin is a hormone that controls the level of glucose, which is a type of sugar in your blood. If you've got PCOS, your body may not respond to insulin, so that means it's known as insulin resistance, and that means the level of glucose can be higher. To try to prevent the levels of glucose becoming too high, your body produces even more insulin. High levels of insulin can lead to weight gain, irregular periods, fertility problems, and higher levels of testosterone. How is it diagnosed? Well, a diagnosis of PCOS is made when you have any two of the following: irregular, infrequent periods or no periods at all, an increase in facial or body hair, and blood tests that can show higher androgen levels or higher testosterone levels than normal. And thirdly, an ultrasound scan which shows polycystic ovaries. Now, seeing polycystic ovaries on scan is a very common feature, especially when you're a teenager or if it's within the first few years of starting your periods. That's not on its own a diagnostic feature. Other symptoms can also include a loss of hair on your head, being overweight or difficulty losing weight, having oily skin, acne, difficulty falling pregnant. Now, the range of symptoms do vary, so some women can have none at all and others can have the whole lot. So can PCOS be cured? Well, unfortunately, currently there is no cure for PCOS. Medical treatments aim to manage and reduce the symptoms or consequences of PCOS. But medication alone has not been shown to be any better than actually making some simple healthy lifestyle changes like weight loss and exercise. Now, options for treatment depend on what symptom bothers you the most. So for example, if it's the hair growth, then certain types of the pill or laser can be used for hair removal and they can be effective. If it's skin, again, certain contraceptive pills or creams can be used. The combined pill can also be used if it's the irregularity of the periods that bothers you, and we'll come back to helping to manage your fertility. So what does having PCOS mean for your long-term health? Well, if you have PCOS, you are at greater risk of developing long-term health problems, and this is not meant to be scary because a lot of the lifestyle changes can actually help to reduce these risks long-term. It's about being aware. There's an increased risk of insulin resistance, and that means there's an increased risk of diabetes as well as blood pressure problems. If your periods are very irregular, then this can allow the lining of the womb to become overly thickened, as you're not having a regular period to shed that lining, and that can lead to precancer or cancer changes in the endometrium, in the lining of the womb. So it's important that you have at least 4 periods a year unless you're on hormonal medications that keep the lining of the womb thin. Now, 5% weight loss can help to restore regular periods and halve the risk of diabetes. So lifestyle changes, which means taking regular exercise, for example, is vital. Your aim should be to try to keep your BMI in the normal range, or as close to it as possible, and the normal range is between 19 and 25. Now, it's not easy and the results may not be quick, but that kind of weight loss and regular exercise can help a lot of the other symptoms like hair growth, acne, as well as improving fertility. So, How can PCOS impact on your fertility? Well, polycystic ovaries contain many small follicles, each of which contain an egg, and they start to grow, but they don't reach a mature size. So those follicles or eggs remain very small. The ovaries are also slightly enlarged, and the central hormone-producing tissue, called the stroma, is also thickened. All of this results in raised level of certain hormones like LH and contributes to you having infrequent or absent menstrual cycles. And this means that you're unlikely to be ovulating regularly. And anybody who is having infrequent ovulation can take longer to conceive. And that's the primary problem in PCOS, is that if you don't ovulate every month, you don't release an egg every month because they stay small, they stay as follicles rather than being released as an egg, that can impact on your ability to fall pregnant. So we know that fertility is adversely affected by an individual being overweight or having higher levels of androgens, those male sex hormones like testosterone, or having an elevated, a higher than typical level of LH, another hormone. So we know that all these things can affect your ability to fall pregnant in PCOS. So your next natural question is, will I be able to fall pregnant? Well, a Finnish study showed that whilst women with PCOS may take longer to become pregnant, their lifetime fertility is not impaired. Another study showed that there are factors that affect your fertility. So those include your age, BMI, so how overweight you are, hirsutism, so excessive hair growth, and the duration, or how long someone has been trying to conceive, affects how likely they are to conceive if they have PCOS. But ultimately, all of this means that if you have PCOS, you should try to conceive as normal, because many people successfully fall pregnant without any concerns, even though they've been told that they have PCOS in the past. Okay, so you start trying to conceive. How long should you wait before speaking to your doctor if you aren't falling pregnant spontaneously? Well, if you are not having regular periods, then the chances are you're not ovulating, and that may affect that ability. So if you're not having regular periods, I would wait for around 6 months, and if you're not pregnant by that time, see your doctor. But if you are having regular periods, then you should give it a year. So if you're having a period every month, try regularly to try to conceive, and if after a year you've not fallen pregnant, then speak to your doctor. So if you're not having regular periods, or if you're not ovulating every month and you have PCOS, what can be done? Well, the first step is to optimize your health before treatment. So if you are overweight or you're obese, we know that weight loss impacts and improves your hormone profile, makes it more likely that you're going to ovulate, and it also makes it more likely that you'll fall pregnant both spontaneously or in response to any medications that we might give you. So the next step, you optimize your health, and hopefully you're already taking folic acid. The next step is to take medications to improve the chance of ovulation. And the first one that you might have heard of is called clomiphene citrate, Clomid. Studies say results in pregnancy in around 50 to 60% of people within 6 months if they are not ovulating regularly and they've got a diagnosis of PCOS. There are several other types of medications that might also be recommended in this situation. The third step is not necessary for everybody, but if you still haven't fallen pregnant, you're under a fertility team, they may recommend further treatments such as ovarian drilling, but those would be recommended on an individual basis. So what about inositol? So this is actually not a medication, but it's a supplement that is available over the counter, and many people suggest it for people with PCOS who are trying to fall pregnant. Its aim is to reduce the levels of insulin that is circulating, but there is mixed views on whether or not it's helpful. Our most reliable source of evidence, a Cochrane review from 2019, found that there was no clear benefit that taking this medication improves fertility. However, other studies do suggest that there is a benefit, and it's worth discussing with your own doctor to see if they would recommend it for you. There's so much to consider when it comes to PCOS, and I hope that the information in this video is helpful. If you've got any more questions, let me know in the comments below, and I'd be really happy to answer them.